Hi everybody, welcome to my YouTube channel, Your Pharmacist Next Door. My name is Nelson Ugu. I am a pharmacist practicing here in Nigeria. I want to say welcome to Your Pharmacist Next Door. I want to say a big thank you to all my subscribers. I want to say thank you for subscribing after my first video. Thank you guys. If you've not subscribed, please do that. Subscribe to this YouTube channel. We have a lot of things to discuss. We have a lot of things to talk about. I'm going to be talking about where you can find a pharmacist. I'm going to be talking about what a pharmacist is expected to do, what a pharmacist is trained to do. And I'm also going to be talking about the types of pharmacists that we have and their responsibilities in wherever they are found. Who is a pharmacist? Is actually a healthcare professional that is specifically trained to store, to handle, to prepare, and as well as dispense various medications. Plays an important role in educating patients as regards to their drugs and how they can actually administer their drugs. Where do pharmacists work? First of all, I want to say this in a nutshell. Anywhere you discover that there are actually drugs that need to be prepared, drugs that will be dispensed or distributed, you're going to find a pharmacist there. Just take note of that. In fact, I want to say without apology that anywhere you go to that drugs are involved and then you don't find a pharmacist there, please be skeptical. You actually find pharmacists in the hospital. You can find pharmacists in the community pharmacy. You can find pharmacists in oncology centers. You can find pharmacists in rehabilitation centers. You can find pharmacists in addiction treatment centers. You can also find pharmacists in nursing homes and long care centers. You can also find pharmacists in poison control centers. You can actually also, what are the responsibilities of a pharmacist? To verify dosage on medications. All right, the pharmacist goes through the prescription. He checks if the dosage is overdose or if the dosage are underdose. Again, the pharmacist actually checks for drug interaction. This is very, very important to note because some patients take more than one drug at a time. So it's important that the pharmacy checks that. So the pharmacist checks for drug-drug interaction, also checks for drug-food interactions. The pharmacist actually educate patients on how to take their medications. All right, and when to take their medications. It will also advise patients on the potential side effects that is expected of the prescribed drugs from the physician. The pharmacist ensures safe medication. The pharmacist ensures that the medications that were prescribed by the physician are safe for the patient. Side effects are actually expected, but adverse drug reactions are not expected. The pharmacist is a basic record keeper of all your medications such that you can actually go back to retrieve those informations. So it's actually a few of the responsibilities of a pharmacist. What are the types of pharmacists that we have? The community pharmacy, we have the clinical pharmacy, we have the consultant pharmacy, we have the pharmaceutical industrial pharmacist. These are the few pharmacists types that I'm going to be mentioning here, and I'm going to be explaining briefly about their duties basically. First of all, the community pharmacy where I am working presently, I will say a lot about what we do, but I'll just mention few. Now, the community pharmacy is actually responsible for dispensing medications, also making sure that I verify prescriptions before I dispense medication. I get involved in educating patients about how to take their medications, and I educate them also about their drugs and their illness. Clinical pharmacy actually works in the clinic, works in the hospital and other centers. Basically what they do is that they are involved in patient care. They actually advise the patients and oversees in adjusting, if need be, the dosage of the medication all through the treatment course. So that is what the pharmacist does in the clinic or the hospital or other areas of importance. And also the pharmacy actually educates patients on their medications and also educate them on their illness, and also checks for the drug interactions, as I've earlier mentioned when I started this video. We have the consultant pharmacist. Now the consultant pharmacist is actually responsible for offering consulting services to the hospital, to insurance providers, and to healthcare providers. The pharmaceutical industrial pharmacist, these pharmacists actually have less interaction with patients, but what they are basically into is research and development of new medications. That is basically what pharmaceutical industrial pharmacists do. The detailing to medical doctors, to pharmacists, and other healthcare providers. That is basically what a pharmaceutical industrial pharmacist does. And I believe that we must have learn something from this video. For my younger ones who want to pursue a career in pharmacy, I must say that pharmacy is actually a noble profession. Maybe in my subsequent videos I'm going to be talking about the pay of pharmacists, what they are paid and all that, so that you will know if you can actually get money from pharmacy. But well, I want to say a big thank you for listening, staying to this time and listening to me. Thank you very much, guys. Please, if you've not subscribed to my YouTube channel, I don't really know what you're waiting for. I promised you that we are going to be learning a lot in your pharmacist next door. We're going to be learning a lot. So subscribe, because I'll be coming up with a lot of contents about pharmacy, drugs, and your health. I said it. So please stay tuned. Subscribe to this YouTube channel. Just hit that button, guys. Hit it. Hit it, man. Hit it. Hit that subscribe button. Give me a thumbs up and hit that notification bell so that when I post videos, you'll be the first to be notified. Thank you very much, guys, for watching.